This material is for information only. It does not replace a doctor visit. It is not a medical recommendation, and any use of sildenafil should be agreed with a qualified clinician. Today I am talking about Kamagra, a product sold as sildenafil, and the key point is simple. In the official sources I retrieved, the recognized original sildenafil medicine for erectile dysfunction is Viagra, while sildenafil for pulmonary arterial hypertension is authorized under the brand Revatio, so the real comparison is Kamagra against regulated sildenafil products rather than Kamagra against some unique molecule. Access data, FDA. Sildenafil belongs to a group of medicines called PDE5 inhibitors, which help blood flow into penile tissue during sexual stimulation. The EMA product information for Viagra and sildenafil activis presents the same basic mechanism and the same adult indication for erectile dysfunction, while Revatio uses the same active substance for pulmonary arterial hypertension under a different authorized label. Online doctor, ASDA. For erectile dysfunction, the standard regulated use is in adult men who cannot achieve or maintain an erection sufficient for satisfactory sexual activity. For pulmonary arterial hypertension, the official sildenafil product in the retrieved FDA material is Revatio, not Viagra, and I did not retrieve a regulator-authorized Kamagra label for that indication, so Kamagra should not be assumed to be an evidence-based substitute for Revatio. Gov. How it works is easier to understand than the chemistry sounds. Sexual stimulation produces a signal called cGMP, and sildenafil slows its breakdown, which helps smooth muscle relax and lets more blood enter the penis, but without stimulation the medicine does not create a normal erection by itself. EMA, Europa. Now the comparison that matters most. In official EU files, regulated generics such as Sildenafil Activis and Sildenafil Teva were judged to have comparable quality and to be bioequivalent to Viagra, meaning they are expected to deliver the same active substance exposure in the body, while I did not retrieve any FDA or EMA dossier showing Kamagra has that same verified status. FDA. There is also a practical difference between nearest therapeutic alternatives and true generics. Tadalafil is a close therapeutic alternative because it treats the same condition by the same broad pathway, but a retrieved comparative analysis from 2025 suggested daily tadalafil may outperform on-demand sildenafil on some erectile function outcomes, which speaks to treatment choice in some men, but does not make tadalafil a generic of sildenafil. PMC NCBI NLM NI. For regulated sildenafil products, the verified forms and doses are clear. Viagra film-coated tablets contain sildenafil citrate equivalent to 25, 50, or 100 mg of sildenafil. The EU product file also lists a 50 mg orodispersible tablet. Sildenafil Activis is available as 25, 50, and 100 mg tablets, and Revatio tablets contain 20 mg for pulmonary arterial hypertension. Online doctor, ASDA. This is also where a gap appears in your brief. The request mentions Levitra, but Levitra is a different medicine, while the official sources retrieved here show that the correct international non-proprietary name for Viagra, Revatio, and regulated ED generics in this review is sildenafil. Access data, FDA. How to take regulated sildenafil is also well described. The usual adult dose for erectile dysfunction is 50 mg about 1 hour before sexual activity. It can be reduced to 25 mg or increased to 100 mg based on effect and tolerability. It should not be used more than once daily, and food can delay the onset. Some people need a lower starting dose. The EMA information advises considering 25 mg in severe renal impairment, hepatic impairment, with some CYP3 or 4 inhibitors, and in men stabilized on alpha blockers because blood pressure can fall further when these medicines are combined. Composition matters when tolerability matters. The official EU Viagra tablet core contains microcrystalline cellulose, anhydrous calcium hydrogen phosphate, cross-camellose sodium and magnesium stearate, while the film coat contains hypromellose, titanium dioxide, lactose monohydrate, triacetin and indigo carmine aluminium lake, so lactose intolerance and rare galactose handling disorders are practical reasons to read the exact leaflet. Gov. For Kamagra, that same certainty is missing in the official sources I retrieved. I could confirm public excipient and quality details for Viagra and the bioequivalence status of regulated generics such as Sildenafil Activis, but I could not confirm an official FDA or EMA ingredient list, manufacturing dossier, or bioequivalence report for Kamagra itself in this search. FDA. The safety profile is familiar and important. In the Viagra label, the most commonly reported adverse effects are headache, flushing, dyspepsia, nasal congestion, dizziness, nausea, hot flush, visual disturbance, cyanopsia, and blurred vision, while rare but serious reactions include priapism, non-arteritic anterior ischemic optic neuropathy, sudden hearing loss, severe skin reactions, myocardial infarction, stroke, and significant hypotension in susceptible patients. Gov. There are also clear situations where sildenafil should not be used. The official contraindications include nitrates, nitric oxide donors, riosiguat, severe cardiovascular states where sexual activity is inadvisable, certain severe liver disease, marked hypotension, recent stroke or myocardial infarction, and previous vision loss from non-arteritic anterior ischemic optic neuropathy. Gov. On clinical evidence, the recent open literature I retrieved is stronger for sildenafil as a class medicine than for Kamagra as a named product. A 2021 umbrella-style review reported that sildenafil improved erectile function versus placebo and supported the effectiveness of PDE5 inhibitors overall, but I did not retrieve a recent peer-reviewed Kamagra-specific trial set with the same regulatory clarity as Viagra or approved generics. Frontiers. The economic case for regulated generics is often the strongest practical advantage. In current public US pricing pages retrieved here, sildenafil starts at about $3.55, while Viagra starts at about $251.30, so when a patient responds well and tolerates sildenafil, a regulated generic can offer major savings without giving up the bioequivalence standard documented for approved products. Goodix. That said, cheaper is not always the whole story. If a patient has had variable response, troubling side effects, complex drug interactions, a need for pulmonary hypertension treatment, or uncertainty about the legitimacy of an online product, it is more reasonable to discuss the exact manufacturer, the exact leaflet, and whether a fully regulated original or a specific approved generic is the safer choice. Online Doctor, ASDA. The main limitation in this review is not the sildenafil evidence base. The limitation is Kamagra itself, because in the official FDA and EMA material retrieved here I found strong information for Viagra, Revatio, Sildenafil Activis and Sildenafil Teva, but not a matched regulator-authorized Kamagra file, so claims about Kamagra quality, excipients, bioequivalence or approval status remain unconfirmed in this evidence set. EMA, Europa. My careful takeaway is simple. If the goal is treatment for erectile dysfunction, the strongest evidence in open official sources supports Viagra and approved generic sildenafil, and if the goal is pulmonary arterial hypertension, the official sildenafil product in the retrieved FDA material is Revatio. So the right question for a doctor is not whether any cheap online name sounds similar, but whether the exact product is authorized, appropriate, and safe for your medical situation. Image Europa. Please treat this as educational information only, not as medical advice, and make any decision about sildenafil, Viagra, Revatio, or a generic only with a clinician who knows your history, your blood pressure, and your other medicines. Save this video for your next appointment, share it with someone who needs a clear explanation, and subscribe to the channel for more careful evidence-based reviews.